Postpartum hemorrhage, it's the leading cause of maternal death globally, and it's estimated to be at 87% of all maternal deaths. So we will define postpartum hemorrhage. It refers to the blood loss of more than 500 mLs of blood during or within 24 hours of delivery. So we will classify them into three. We have the primary postpartum hemorrhage, secondary PPH, and refractory. So primary, it occurs within 24 hours of delivery. Secondary, it occurs within after 24 hours to 6 weeks of delivery, post-delivery. Then what are the causes or the etiology of postpartum hemorrhage? We will have four T's. One, we have tone of the uterus, that is at 70%, the tonic uterine, whereby the uterus does not contract after delivery, so there is increased risk of bleeding. Two, we have trauma at 20%. The trauma we can have from the uterus, the cervix, due to what are they called, tears, and any other injury to the uterus, to the cervix, to the vagina, and any other surrounding structures. We also have products of conception at 10%, whereby we can have retained products of conception that remain in the uterus that will cause or will increase the rate of bleeding. Then at number 4, we have the, what is it called, coagulable states, that is hypercoagulability. We can have the DIC and other coagulable states. Yeah. So what are the risk factors of postpartum hemorrhage? We can classify them into antenatal and intrapartum. Antenatal, this is before delivery or the period before delivery. So increased risk is women of 35 years of age and above. We can have also women who have what is called fibroids are at increased risk. We also have previous PPH, and we also have conditions like preeclampsia, anemia, gestational diabetes, multiple pregnancies, polyhydramnios, or antepartum hemorrhage. All these are antenatal factors that can lead to postpartum hemorrhage. Then for intrapartum, during the induction of labor, we have prolonged labor at the second stage or third stage, prolonged labor. We can also have retained products of conception, that is maybe the placenta. We have instrumental vaginal birth, whereby some instruments are inserted to aid delivery. We can have microsomia, that is a big baby above 4.5 kilograms. Most at risk are the diabetic mother, tend to have increased risk of microsomia. Then we have uterine rupture during delivery, and general anesthesia, genital tract injuries, and any other infections. So these are the risk factors of postpartum hemorrhage. So see you next time. Bye.